Standard Operating Procedures, Part 1, Introduction. Introduction. This resource manual has been updated to summarize some of HBI's standard operating procedures for outreach, education, screening, testing, and linkage to care services. This resource should be reviewed and updated annually to reflect best practices and lessons learned each program year. This document should also be used as a training manual for HBI staff and volunteers to better understand the organization and its operations. The resource manual contains provisions on cleaning, disinfecting, social distancing, and state-specific information in DC, Maryland, and Virginia. Let's learn a little bit about HBI. Founded in 2006 as the Hepatitis B Initiative of Washington, D.C., HBI is a 501c3 nonprofit organization with a mission to mobilize communities to address health disparities, including preventing infectious diseases and liver cancer by detecting HBV and HCV infections early that affect vulnerable populations. Through collaborative partnerships, our organization provides culturally and linguistically appropriate outreach, education, screening, testing, vaccination, linkage to care, and patient navigation services for impacted communities to promote immigrant health equity. Annually, HBI has the capacity to outreach, educate, screen, test, and link over 2,000 individuals to healthcare and treatment services throughout the Washington, D.C., Baltimore, Maryland metropolitan areas. Our multilingual staff collectively speak over 9 different languages, in addition to English, including Amharic, Chinese, Mandarin, Cantonese, and Shanghainese, French, Korean, Mongolian, Vietnamese, and Yoruba. We also have volunteers who speak Burmese, Cambodian, Laotian, Spanish, Tagalog, Filipino, and Thai. How was HBI founded? Your brother has a massive tumor in his liver caused by hepatitis B, and I'm afraid your mother has hepatitis B too. Leslie Shuo could never forget the doctor's words. Her brother, John, was only 17 at that time. He died a few months after he turned 18. A year later, Leslie's mom, who never stopped blaming herself for passing the virus to her son, died too. It was then that Leslie learned that her family could have been saved by a simple vaccine or a timely screening, even before any of the symptoms started to show. As a student at Harvard, Leslie reached out to allies, and HBI was officially established in 1996. It was the first organization to not only offer free screenings, but to leverage the students' ability to facilitate partnerships between community organizations and empower them to develop their own cultural and linguistically appropriate campaign. Today, HBI has grown into a well-structured organization while maintaining its grassroots operations. This allows HBI to offer volunteer opportunities to public health and medical students. There are office opportunities such as MPH practicum and internship projects, supplies, inventory organizing and packing, fundraising and donor solicitation, as well as event opportunities such as language translation and interpretation, registration at screening events, crowd control for safety and security. Please note that volunteer opportunities are usually for individuals ages 18 and older. High school students who are under the age of 18 will only be considered if they have demonstrated exceptional maturity and experience. HBI has volunteer training guidelines. This includes review volunteer application, interview, and process criminal background check if applicable. Provide volunteer with orientation training that includes review and resource manual and overview of HBI programs and services. Identify who will supervise the volunteer. Provide volunteer with clear written job description and work plan. Provide PPE with instructions, and allow volunteer an opportunity to evaluate their experience. Here is a sample volunteer application. Please note that all volunteers will have to agree to HIPAA guidelines as well as their waiver of liability. A volunteer work plan needs to include the volunteer name and contact information, name of supervisor and contact information, a job description, location of volunteer service, the date and time of volunteer service, signature of volunteer and supervisor, and the opportunity for evaluating the volunteer experience. So what does HBI do? HBI provides a cascade of care, which includes outreach, education, screening, testing, linkage to care, and other resources. To learn more, please proceed to the next part of the training.